Healthy Living in the Four Corners is brought to you by Southwest Eye Consultants. Thanks for watching Healthy Living in the Four Corners. I'm Deborah Rhoda. Have you recently been diagnosed with diabetes? Then you may want to make sure you visit an ophthalmologist to have your eyes checked for a condition called diabetic retinopathy, especially if you begin to experience blurred vision or little floating specks in your eyes.
Diabetes affects the small blood vessels, so blood comes into a tissue via arteries, divides into 1 million capillaries where oxygen and nutrient exchange occurs, and then is taken back to the heart by the veins. And diabetes attacks the eyes and the kidneys first because they are very active tissues and they require these tiny little blood vessels in order to supply the organ with the nutrients it needs. So what happens in the retina is you get poor blood flow. And when you have poor blood flow, it causes inflammation, it causes abnormal bleeding and swelling of the retina. Ultimately, it can cause vision loss from all of those things, but also creation of scar tissue as a result of these insults to the tissue and cause a traction retinal detachment.
Dr. Haug says a number of different treatments can help diabetics retain their vision, but the causes are systemic, and it's important for diabetics to take care of their health.
There are different lasers we can use for various types of diabetic retinopathy. More recently, we've been using some of the same drugs we use in macular degeneration for patients with diabetes. It helps improve the blood flow to the tissue, and it also helps reduce some of the complications of diabetes in the eyes. We also end up doing surgery in some cases to remove some of the abnormal bleeding and repair detachments as needed. The biggest issue in diabetic patients is just making sure the blood sugar is under control. What often happens is you have a new patient who didn't know they had diabetes with sugars out of control that come in and they have a lot of changes in their retina. Once their sugars get under control, it can take a full year for us to get the eye under control, but sugar control is the biggest thing patients with diabetes can do. And then the other thing is if there are complications in the eye, the earlier we get to it, the better. So close monitoring by your ophthalmologist.
If you'd like to know more about cataract surgery and the options available to you, contact southwesticonsultants.com. I'm Deborah Rhoda for Healthy Living.